Good day, grade 10 students. Welcome to our health class. Today we're going to learn about the significance of global health initiatives. Meaning to say, what are the global health issues that we are experiencing, especially this time? So I guess this topic of ours is very essential because we are experiencing the deadly pandemic called COVID-19. So let's all be careful. So I'm also very excited to discuss this to you because this is very timely of what is happening today. So talking about global health initiatives, so we have different global health issues. So what are the illnesses? What are the different global health issues and concerns to people across the nations? Not only in the Philippines, but in the whole world. So that's why we call that's why we call it pandemic because everybody, the whole nation, in the whole world is experiencing the same thing, same illness, no same infections. So that is the COVID-19. Which pandemic mean to say everybody is experiencing, not only in the Philippines, not only in China, not only in America, but in the whole world. So we always have these issues like the malaria, the dengue, tuberculosis, polio, and a lot more. So these are the global health issues that we all experience. But now, this is very, very timely because we are suffering, actually struggling for a certain global health issue, and that is the pandemic COVID-19. The term global health rose in popularity along with the rise of globalization. Both terms improve public awareness of vulnerabilities and shared responsibilities among people for the different injustices in the world. So, global health class pertains to various health issues, concerns, and trends which go beyond national boundaries and call for global initiatives for the boundaries and call for the global initiatives for the protection and promotion of people's health across the world. Global health is an area for study, research, and practice that prioritize health improvement and achieving impartiality in healthcare and wellness worldwide. Global health, diverse health issues, concerns, and trends which call for all the nation to address and act on to promote and protect health of individuals and group across boundaries. So what is happening today? The global health is very active. The global health is in action because we all want to solve this problem. We all want to research and find out what's the best vaccine for us. There are a lot of vaccines that came out, like Sinovac, AstraZeneca, Pfizer, and a lot more, but we still do not know which one is the best for everyone. But all of those vaccines are good to protect and make us more stronger in fighting the COVID-19. So we are trying to merge and join forces, join them in thinking and researching of finding a solution to stop and fight COVID-19. So what is WHO? World Health Organization. W, World, H is Health, and O is Organization. That's why it's called World Health Organization, or in short, WHO. What is the role of the World Health Organization? The role of the World Health Organization is the primary international body responsible for developing leadership in health, setting norms and standards, and providing health support among nations around the world. So it is the World Health Organization who is actually researching and giving us the insight, telling us what to do, telling us on some solution, educating us of what are we supposed to do, like the wearing of mask, the social distancing, to get away from that deadly virus. Okay? So we have global health initiatives. So we have different types of global health initiatives. When we say global health initiatives, these are the ideas on how to stop viruses, how to be healthy, how not to be infected, or how to kill all those issues, health issues, like those health illnesses. Number one of the initiative is to stop the tuberculosis, because tuberculosis is also very known in not only the Philippines but in the whole world, because tuberculosis is infectious. This tuberculosis, or TB that we call, is also very infectious because this is airborne. Okay? When we say airborne infection, you may transmit the virus, the pathogens, the bacteria through the air. So when someone is infected, if you are infected of PTB or tuberculosis, when you cough, your saliva might spread out through air. So when you inhale it, when someone's immune system is very low and was able to inhale that air, infectious air, infected air, you might be infected also with that certain illness like PTB. So it's airborne. Okay? So rollback malaria. What is malaria? Malaria is a kind of illness, virus that we get from the mosquitoes. So usually mosquitoes at night, during nighttime. So that's why usually the people who always get infected with malaria are the soldiers who are always on the field, in the grass, in the mountains. So that is always at night. So these mosquitoes, infected malaria mosquitoes, usually comes out during nighttime, okay, from a mosquito. We also have global fund to fight HIV or AIDS. We also have funds, okay? Part of the initiative is to stop spreading HIV and AIDS. So we have certain people on having program on how to educate people to stop or to not to be infected with this kind of illnesses. Also, very timely as of this time, because of what is happening to us. We are almost like 2 years, almost. We are more than a year already experiencing, struggling this COVID-19, the pandemic COVID-19. And we are all stressed, not only physically, but also mentally. So that's why sometimes we hear people who committed suicide, and that is not good. Um, Getting depressed because of mental illnesses, mental health problem. Today, we are experiencing the very uncomfortable life because of the COVID-19. And we are all having problem on how to live our life, because some of our friends, some of the people who need to stop working because all of the business, the establishments, the company are already declaring bankrupt because of this situation. So everybody has sometimes need to stop to work because the agency or even the company is also getting down. So we are getting stressed mentally. So we have funds for that, especially this time. So we have enough programs for that. Okay? So we also have strategy to reduce harmful use of alcohol. So for those who are alcoholic, so we cannot actually stop it right away without even passing a process. So we have programs for that. also for addiction, smoking, drug using, okay, prohibited drugs using. So we have programs for that. So these are the initiatives of World Health Organization. But now, this time, we are focusing more on about COVID-19 because we have a target on how to get away from this problem. This is worldwide. This actually affects everything in our life. Okay, no matter how rich you are, no matter how poor you are, we are not all excused and we are all afraid of this pandemic, COVID-19. Okay?